Hi guys, welcome to the channel. Thank you for joining me and thank you for your continued support. Yep, I know it looks terrible. I'm going to work on it. Anyway, today I'm going to be talking about the COVID inquiry. Now, the reason why I'm going to talk about it is because it's come up with some really interesting findings. Some, of course, which I'm sure you will not be surprised at all. But it's also interesting that the way that these things failed is interesting as well. So I'm going to read through it so you can let me know down in the comment section what you think. So, the Conservative government repeatedly failed to take action to protect disabled people in the early months of the pandemic, even though their risk of dying was twice as high as non-disabled people. That's according to this key COVID inquiry. The report highlights the failure to include the Disability Minister in key ministerial meetings and the decision to sideline the Disability Unit from work on the UK government's initial strategy in the early months of the pandemic. It also says that Boris Johnson's government failed to address gaps in data and analysis relating to the impacts of the virus on disabled people. The second report of the COVID inquiry, which focuses on core decision-making and political governance, says that disabled people would be exposed to a range of different and higher risks should have been obvious. Well, of course it should have been obvious. I mean, you know, it's just basic medical knowledge, isn't it? You know, if you are a disabled person, particularly if you are immunocompromised, you're going to have bigger problems than someone who isn't, for example. In England and Wales, the risk of death involving COVID-19 in March to July 2020 was twice as high for men who reported being limited a lot by their disability than men who reported no disability, while for women the risk was 2.4 times higher. In Scotland, from March 2020 to January 2021, the risk was 3 times higher for men and 3.2 times higher for women. For people with learning difficulties, the risks were even higher. In the early months of 2020, a person with learning difficulties aged between 18 and 34 was 30 times more likely to die from COVID than the general population of England. The inquiry report repeatedly highlights how the impact on disabled people was ignored in the early months of the pandemic. It says neither the Disability Unit nor the Disability Minister had played any part in the decisions about whether to implement a lockdown, how the decision might be mitigated, or the policy on the discharge of hospital patients into care homes. An interministerial group set up on the 16th of March to consider the impact of the pandemic on public services did not even consider the position of disabled people until May 21st, while the Disability Minister was never a permanent member of the group. The report on different outcomes from COVID-19, commissioned from Public Health England and published on June 2020, included no analysis of the risks to disabled people. And it was not until the 12th of November 2020 that Public Health England published a report that considered the disappropriate number of people with learning difficulties who were dying from COVID-19. Which is absolutely right. I mean, you know, most people who were disabled at that time during the pandemic knew that things weren't right. They knew that things weren't being tailored to their needs as much as anything else. And yeah, okay, it was a pandemic. Lots of people were learning things on the hoof. But, it's just glaringly obvious that disabled people may well be more at risk than people who aren't disabled. People with certain conditions might be more at risk than people without those conditions. I don't understand why this wasn't even a part of their discussions for such a long time. It really is bizarre. Let me know down in the comment section what you think. I would love to hear your thoughts on this. Please do subscribe if you got this far, and I'll see you next time.